Hi, my name is Elena, and today we will be learning about intravenous catheters. The correct name for an intravenous catheter is actually a cannula or cannulae plural. However, they are routinely referred to as an intravenous catheter in veterinary medicine. Intravenous cannulation, or catheterisation, is used to gain a point of access into the vein for the purpose of administering fluid therapy or medication, and can also be used as an access point for obtaining a blood sample. Veterinary intravenous catheters are typically constructed primarily from polyurethane, but silicone or Teflon may also be utilized. The main reasons that polyurethane is a desirable material for catheters is that it is bistable or resistant to the effects of microorganisms, and flexible. This minimizes the chance of infection and thrombophlebitis because of the reduction in stress on the vessel walls. Catheters are measured and color-coded based on their gauge. The gauge refers to the size of the lumen, with 26G catheters having the finest lumen and 14G catheters having the widest lumen. In the small animal veterinary clinic, the most commonly used gauges are between 20G and 24G. 20G catheters are typically reserved for larger and giant breeds, and finer lumens are used for cats and juveniles. Catheters can also come in a range of lengths, usually between 19 mm and 40 mm. There are four main types of veterinary intravenous catheters. These are over-the-needle catheters, through-the-needle catheters, winged or butterfly needle, and multilumen. Over-the-needle catheters are the most commonly used in veterinary medicine. They are relatively inexpensive, and the techniques needed for placement and maintenance are less complex than other catheter types. The catheter is housed over the top of a steel needle. Once the needle enters the vein, the catheter is extended past the needle and into the vein before the needle is removed and discarded safely, allowing the catheter to be secured in the vein. Through-the-needle catheters are less commonly used than over-the-needle catheters, and are either designed for the needle to either be inserted through a plastic sheath, which is then peeled off and thrown away, or stay attached to the needle and secured inside a plastic guard external to the vein. Winged needles, also called butterfly needles, are only suitable for short-term use, such as for the administration of drugs or obtaining blood samples. The plastic wings on the shaft aid in the placement of the needle. They can be quite unstable, and taping should occur behind the wings, rather than over the top of the wings to prevent movement. They are available in a range of different needle gauges, typically between 25G to 19G. Multilumen catheters can be either over or through the needle forms. The multilumen catheter is placed in the same manner as other catheters, but have multiple lumens which can support multiple infusions at a single insertion site. They are not commonly used in general veterinary practice due to their expense, and are most commonly used for central vein catheterization. Want to learn more? Scan these QR codes to learn more about intravenous catheters.